Hi, and welcome to another edition of Newsmakers Journal of the Vaccine Year. I'm Jerry Roberts. It is Wednesday, May 26th, and we have a special press clips edition of Newsmakers today where we go inside the news, and I'm delighted to welcome Giana Magnoli, the managing editor of Noozhawk. Thanks for taking the time.
Yeah, thanks for inviting me, Jerry.
So I want to talk a little bit about your Noozhawk's coverage of the pandemic over the past year, and people are kind of finally getting a little, you can breathe a little bit thanks to the
Yeah.
vaccination and other things. Um, but before we spoke, I did a search of your bylines and your COVID coverage on Noozhawks since last March. It's nearly 1,500 stories. What has it been like for you? I mean, is it all just a blur, or were there specific points at which you took a minute and said, "Wait a minute, what are we doing here?" What's your reflection on it overall?
It's definitely been a very busy year for me and everybody at Noozhawk. I mean, we all got thrown into the COVID beat at once, had to learn it from scratch because it was something completely new, and it was really reactive at first. We had to figure out what was happening and what was coming next. And I'd say it wasn't so much a blur as kind of broken into a lot of segments. I mean, anytime public health guidelines changed, I have in my mind, I have very distinct chunks of like the reopening 1 year ago around Memorial Day. And then, that summer that led to more closures, that led to fall, that led to winter. Things got better earlier this year. The vaccination started. So it's very big chunks in my mind. But some of it is definitely like the day-to-day blur. If you sent me a specific day, even a couple of weeks ago, and said, what were you doing on this day? I'd have to go check my bylines and see what I was doing.
Well, a couple of important dates. The first case in Santa Barbara was March 15th, 2020. And the governor 4 days later issued a stay-at-home order. But what I found interesting was the day before that, Noozhawk, or you did, posted the first set of resources for people to try to figure out what was going on. And I thought that was a very a notable aspect of your coverage throughout. It was very involved with the readers, specifically reaching out to them.
Yeah, we really wanted to help. And I think public health did this obviously too, is really wanted to help people like make risk assessments for themselves and get information for themselves. We obviously write stories every day, but people don't always read them every day. So we want to make sure that the info is there so they can go find more on their own time, on their own schedule, whatever's relevant to their lives. Because, not everyone will be interested in or care about the same thing as everybody else, even as it relates to COVID public health stuff.
So when you started, say with that first resource thing, what was in your mind? This is going to be a couple of weeks or whatever. I mean, at what point did it, sort of the light bulb go on and you say that you were really in this for the unknowable future? It was just a long haul thing.
Yeah, I'm not sure when exactly we knew. I mean, I think in those early months, if you look at our stories, then people were saying, I don't think stay-at-home orders will ever, are appropriate for Santa Barbara. Even then, people were like, oh, are masks ever going to become a thing here, like in April? And I was like, yes, they're definitely coming. I mean, people here were wearing them before we even had a mandate, if you remember, like going grocery shopping last April. But I think it probably was around a year ago, Memorial Day, when basically like we tried reopening for the first time, right? Virtually everything reopened over a 3-week period in May and early June. And then cases, like things got bad again. So I think that's when you realized, oh, like that one short try wasn't going to do it. So this might take longer.
Yeah. And you, as you say, everybody on the staff, which is, not a large staff, was involved
Yeah.
in covering. What was your specific role?
Yeah.
What was the managing editor doing?
I think our our work makes us look like we're bigger than we are for sure over the last year. And yeah, I can't brag enough about everybody at Noozhawk over the last year. They've done such incredible work. Everyone had to do COVID coverage and then everything else they were already doing. My role really is being managing editor at such a smaller newsroom means I have a lot of different jobs. I'm assignment editor, which means I'm making sure, everyone else has the stories that they're working on. I've really been kind of the main person reading everything about COVID to make sure we knew what was happening throughout the county, throughout the state, throughout the country, throughout the world, to make sure we were caught up on the big issues of the day and what was coming next. So that's
Yeah.
been a big part of my job over the last year, is reading everything every day.
And the other thing that was striking to me that differentiated your coverage was really the reliance and the emphasis on data that you put out. Talk about that a little bit.
Yeah, we have a Google Sheet spreadsheet that we all contribute to, and we've been updating it every day since March 25th, 2020. And so we use all of the county's daily status reports. So we have, new cases, test positivity, hospitalizations, all of that stuff. And we need that because the county doesn't have that historical info available online anywhere, going back the whole time. So we have it, and that's how we know, there have been no deaths reported since April 30th. This is the lowest hospitalization since X date in October. We have a 3-week trend of going down. Like, that's how we know. So we have that data, and it's real time when we put it in. It's such a valuable resource for us going back, because then we can add that historical context and, making charts like active cases over time, hospitalizations over time, and, linking it to public health guidelines changing. It's been really good to give us context. And a hard thing with COVID too has been, showing people the real world impact of those numbers, because it's one thing to say hospitalizations are high and there are a lot of cases, but that means, when it's spreading a lot in the community, more people are going to get sick and die. When it's spreading less in the community, less people are going to get sick and die. And you just have to make sure you're always connecting that for people, so it's not just a chart of theoretical numbers.
So contextualizing it
Yeah.
is what you're referencing. And I mean, if there's one cliche I don't want to ever hear again after all this, is we're designing the airplane as we're flying it, or we're flying it as we're building it, or so whatever the hell it is. But you were doing that at the same time that the public health department, the county public health department, was doing that, and they were doing it at the same time that the state was doing it. And
yeah,
your publisher has been not shy about his expressing his opinions about how the state is done, and kind of the shifting mandates. How have you adapted to that? What's been your experience with trying to keep track of what Gavin Newsom's thoughts are in all of this?
Yeah, well, it can be hard because he doesn't always give you a lot of notice that things are changing. Like, you have to keep track of all that, because he'll announce things before telling public health departments occasionally. I think that happened less as time went on, but the public health department will get surprised with stuff. And that was always really hard, because we'd go to them for, reaction and some like, what's that going to mean here? And they're like, we just got it too. I don't know yet. Like, we'll have to find out and get back to you tomorrow. So that's hard, because we would announce a change, but not be able to tell people right away what that change would mean for their everyday lives. Like, there might be a little delay on that. So that was hard. And I think we're seeing that now with the June 15th, where we don't know what June 16th is going to look like, at work, at play, at school, at general life.
Well, that's a good example of what it is. I think you had a story, I think Jade wrote today or yesterday, that said, oh, we just missed going into the whatever. What are we in, yellow now? Or
no, we didn't get yellow, so we probably won't before June 15th, or
right.
we will for a week.
We can't be in yellow because we're off, by
0.1. Yeah.
0.1, but on June 15th, it all goes away anyway.
Yep.
I mean, it strikes me that there's been a lot of arbitrariness. As you look back on it and how government has managed it. What are your thoughts?
Yeah, I think transparency has been a big issue. Sometimes I think there are good public health backed reasons for something, but that might not be what gets out to telling people. Um, like the June 15th, no one's really said it out loud, but I figured the June 15th probably is linked partially to the fact that vaccinations didn't open up for all ages until mid-April. So like, if you were early and got your first dose in mid-April, you're only now, nearing June being fully vaccinated. So it's giving people more time to get it. Because Johnson & Johnson, of course, is 2 weeks, but the other ones are 5 or 6 weeks from first, from number one to done. So that's a long lag time for people.
Yeah.
But, no one's said that's the reason. So we can't really be sure. And I think he's trying to avoid having the instant implementation of a public health guideline with 2 days notice. He's trying to give counties and give businesses more expectation of what's coming. But we still don't really know exactly what's coming.
Yeah. The other thing that I think back on how public health has done, there was that moment when they said, oops, we accidentally didn't count a bunch of dead people. What
Yeah.
was that all about and how did that come about?
As far as we know, it was just record problems between the county and the state. Like the county has, or the state rather, has changed or updated its reporting system multiple times. And whenever they do it, numbers get wonky. They're also reporting delays between counties and, like providers and the state all along the like path of stuff. And we see that with vaccinations too. They'll report a number of vaccinations on a day. And, if you look at the numbers for that day, a week later, they're higher just because it took a while for all the reports to trickle in. So I think it was something like that, but it was like 28 deaths, I think they announced on one day over
Right.
2 months. So it almost like doubled the number. And
Yeah.
all I can think is those deaths probably weren't in hospitals. So it probably had to go through the coroner or the individual provider. So they may not have come as directly to the county as like hospital reported deaths.
So what's your assessment overall of how public health, has performed under the circumstance?
Well, I mean, I can only really talk about it from like a public information standpoint
Yeah,
because I don't, I'm not a public health expert
right.
despite the past year. But for public information, I think they've given it a good try. Like they put information out there. I think a challenge has been knowing what information people want versus what they know is important from like an epidemiology standpoint. Like the stuff that's important to them for actually doing public health good might be different than what people just need to know about like where things are going. So I think that forward looking stuff and putting stuff in context was a challenge like along the way.
Yeah, one of the other things that has been striking to me of your coverage has been your invitation at several points to readers to say, "Oh, what are your questions about vaccines, or what are your questions about moving into this tier?" And invite and then giving a form, an email form for people to send you. How much um, did you hear from readers on that, and how much of a pain in the neck was that once you got them having to now watch what you wish for, having to respond to them?
No, it's been really good. I mean, even before we started doing like the specific call outs, we've heavily relied on readers to help us out with COVID coverage because we can't be everywhere and do everything. And they've sent us questions where it's either things that we know we've been asking, but having that validation that like people in the community are asking it too. We'll be like, okay, now you can go to public health and say, look, it's not just me who needs this information. Like our readers are asking us, the community needs to know, please like provide context for this. And then yeah, the specific call outs have been great. I mean, we've had people giving us so many story tips and suggestions and questions on what they need to know and what they want to know, and just hey, when this happens, make sure to ask about this. And we've even
Yeah.
asked some of the questions at the county briefings from readers.
How many county briefings do you figure you've attended via Zoom?
Oh, I've watched almost all of them.
Have you really?
Oh yeah, and I mean, then that's just me. Like we as a staff have obviously watched all of them, but I personally have watched almost all of the Friday ones and all of the Board of Supervisors presentations, yeah, in the last year.
Not
I have
getting
to
enough
make sure they don't, I have to make sure I don't miss anything.
The other thing that's been striking about this story, which is, I think, unlike any story that any of us ever have been involved with, is that it's a series of interlocking crises. I mean, you have the public health crisis, but then you have obviously the economic crisis from the lockdowns and the shutdowns. The schools thing has been a huge piece of it.
Yeah.
And then in the middle of it, of course, the George Floyd killing and the protests and, questions that have been raised about issues of equity in terms of COVID itself. How, talk a little bit about the nuts and bolts of how you went about covering all of that. Did you have a daily call at 8 a.m. to decide we're doing this, or what? How did that work?
Well, it's hard because, like you said, it's not just one thing and the impacts of this. I think we'll probably be reporting a lot more about the economic and long-term, impacts of this into the summer and the rest of this year, especially once we find out when all of the eviction moratoriums are going to end. They're supposed to end in June, but I have a feeling those might be extended. But if not, like that's going to be a big issue. If unemployment benefits and rental assistance and things like that, if the resources go away before jobs come back, that's going to be a really big deal. So we're going to have a lot of stories based on that. But as we've gone along, it's been hard. I mean, we just have kind of a running lists of issues and try and make sure we're keeping on top of, last year it was with the PPP loans and making sure people knew about what resources are available and track trends, unemployment trends, housing stuff, all of that. But yeah, it's a lot of balls in the air with the impacts of this.
So, where are we today in terms of the vaccines? I mean, are we seeing the light at the end of the tunnel? Are we at the end of the tunnel? What's your assessment?
Well, the public health officer said light at the end of the tunnel last Friday, because we're hitting about half of people in the county of all ages are fully vaccinated, and a lot more have had at least one shot so far. So we're not sure really how many is ideal to get it under control enough to be sort of like other diseases that are just exist with, but you're not worried about huge outbreaks and shutdowns and things like that.
Are you,
So yeah, so they think we're getting near, especially with summer and so many activities move outside, which we know is much lower risk for transmission. I think they're feeling really good about summer.
yeah, I'm one of those people. I think it's called cave dweller syndrome, who's really sort of nervous about coming out. Um, to what extent are variants of COVID of the virus still an issue, and how much concern do you sense and do you hear from your sources about that?
Yeah, I think they're a concern. I do think that evidence they have so far is that the three currently approved vaccines have performed well against the most prevalent variants that are in California and in the country right now, which is the West Coast strain and the UK and I think the South African variant. The variants that are circulating in India right now are not as prevalent here, and I'm not sure if we have as much information about how the currently approved vaccines do against those. And I think the concern long term is obviously like new variants that don't even exist yet. So it's impossible to know probably how those are going to impact things and whether we're going to have some kind of booster situation to address that in the future.
Yeah. So this is not a story that you're going to be letting go of anytime soon. I take.
No,
Yeah.
no, and we don't. That's one reason why we created the weekly newsletter, because we thought even if we're doing fewer daily stories, we're obviously going. I mean, the impacts of this public health, economically, everything are going to be going for a really long time, definitely through the end of this year. probably pretty big impact. So we're not letting go of it anytime soon. And I mean, public health officials and CDC, they're learning new things every day. A lot of it's good news right now, but I think we're going to have developments on this for a long time.
Yeah. And you mentioned the newsletter, which you started, I guess, last month sometime. So from a journalistic point of view, the purpose of that was what? To again contextualize the information, or try to do fewer dailies, or
Yeah.
get off the hook, or what?
No, it's everything. The main reason I wanted to do one was to contextualize that information and give it to people in their inboxes so they could get basically a whole week's worth of the most important stuff in one place. So they, even if they had a really busy week and only checked in on Noozhawk a couple times and missed, our one big story on the briefing with all the latest info, here it is. So if people end up reading fewer stories, or if we end up writing fewer stories, and it just contextualizes everything that's going on and gives people resources and the latest info. And it's had a really good response so far. We've had a lot of people sign up, and it has a really good open rate, which is good.
So, and when does the newsletter come out?
It actually just went out about half an hour ago, but it's free, and it's emailed to everybody who subscribes to it on noozhawk.com/subscribe. So it goes out Wednesday afternoons at 1, and then we post it on our website in web version on Thursdays for anyone who doesn't want to sign up or isn't able to sign up. But you should totally sign up. Then it's just in your inbox. You can read it at will. But it also goes out to anyone who signs up for our AM report, which is the morning daily headlines.
All right. Hey, Giana, here's do we have now an oversupply of vaccine? Do we have more vaccines than there is demand for now? I guess we're over 50%, but it would be nice to get higher. What's the status of that?
Yeah, so basically we had way more demand than doses for 5 months, like solid. And then starting really in April and the end of April, supply really started shooting up all over the country, and people were able to get more doses out. So at first it wasn't just that like demand was dropping, it was just that we had so much more supply, we finally could give it to everybody who wanted to come in. But now the amount distributed each week is going down a little bit from the previous week. But it's still higher than it was before March, like for every week.
And in talking to your sources, do you have a sense of, what percentage of people, or how many people, just are going to refuse it? They don't want to have it. And, there's this phrase, vaccine hesitancy, whatever that means. Well,
Yeah.
what does that look like to you?
Well, I'm not really sure locally. I know there have been a lot of polls on this, like on a national level, and I think a lot of people from polling and reports on that I've seen, a lot of people are still kind of in the wait and see. I mean, some people don't want to get it, but I do think a lot of people, it's more of an access and convenience issue. If it's not offered anywhere you go in your daily life, and you work multiple jobs, then it could be hard to go get one. And after, if you're hearing from friends that, oh, they had a headache the next day, they might not want to schedule it right before, they have a really busy day at work, kind of thing. But I think they're making the access easier. So hopefully people who didn't want to get it when it was really hard to get it, because you have to remember how crazy demand heavy it was or earlier on. So now we just have to keep, I think, getting that message out there that it's convenient, it's free. If you do want to get it, you could go get one tomorrow anywhere in the county if you want one. And I think that's probably what they're pushing right now.
And then with the mobile vaccine units as well. I mentioned earlier that I had gone and just done a search of all your stuff over the past year on this, and it's interesting. Again, the first case was March 15th, 2020, but 2 weeks before that, on February 28th, you had a piece about the solutions journalism network, and having I guess a workshop in your office on that. What does that mean, solutions journalism, and how is that applied to your coverage of COVID?
Yeah, we did. We had journalists from a lot of different outlets in one room at one time in late
Oops.
February last year. It was, it was nice. But yeah,
No coughing, I hope it was going on there at that time.
no coughing. We wouldn't let anyone come coughing anyway. The we're part of the Solutions Journalism Network, and I went to one of their conferences in the year before, so 2019. And solutions journalism is really just all about looking for what's working, not just, it's kind of not the follow up, but you have a lot of accountability journalism showing you what's wrong or what the issue is. And solutions journalism looks at things that are working in response to big systemic issues. So we've done some of that with COVID, looking at things that are working, whether it's targeted testing, the mobile vaccination clinics that reach people where they are, make it like, here I am, would you like one right here, done. That seems to be working pretty well. And we want to do more of those kinds of stories, so people aren't just writing and reading the same story saying this is an issue, this is an issue, this is an issue, when you can look at, well, is anyone doing it better? Is there something that's working in, say, Ventura County that we could copy and do here? So that's a big goal of it.
Yeah, and has that been useful to you in your coverage of the pandemic? Is that those techniques?
Yeah, I definitely think so. I mean, you want to look at what's working because you can boost the profile of that stuff, so then maybe other people do it. I know that other counties were copying the Santa Maria farm worker vaccination clinic that they did pretty early on, I think at the end of March. Because they were really organized and worked with community partners, and that became a model, and we wrote about that, and other counties were going to copy it. Like, that's the kind of thing that if the news gets out, it can help other people.
Yeah. Well, I have to say, as someone who had the opportunity to work in the business, when it was, gangbusters for newspapers, and then, went through the transition as the internet came on. The real, it seems to me, fundamental question, and the real change that's come about is in, with the legacy gatekeeping model of journalism. You were kind of writing for yourself and your sources, and it was like, where did the readers go in all this? And I think as we moved toward the internet and then past, in those early years, that's what it was about. And I think I just wanted to really call attention to what I think has been the strength of your coverage, of Noozhawk's coverage, is the engagement with the readers, and that doesn't happen by accident. I mean, it really takes a forethought and reaching out and trying to do that. So that seems to be the most important thrust of your coverage, and something that's really worked well.
Yeah, it's been really, really important, and we want to get better at it. Some larger newsrooms have like engagement editors. We don't. We all do it ourselves. But it's really important to us to not have that old-fashioned news model of, you write it, you put it out in the world, and you're done. Like, we want to engage with people. I mean, it's our community. We all live here and work here, and things we experience in everyday life can become stories just like anybody else. So it's really important to have that two-way street.
Yeah. Well, I just want to compliment you and call attention to that. And, people, just as a consumer of news, it's just there, and it just kind of appears, and it's no big deal. But I have a sense, I have an idea of how much work and effort and thinking and forethought went into that. So I want to just congratulate you and compliment you on a great year of coverage of the pandemic.
No, well, thank you. It's been a lot of work, but we think we've done a good job, and we'll see what the next couple months bring for coverage.
And now you're going off, right, for the weekend. You're going to go out into the world and.
In the world, yeah, I'm visiting. I'm going out of town this weekend. Yep.
Is that your first? Is that your first foray out since the pandemic started?
No, but the first one, like visiting people, like specifically. So like these people. So it's going to be really nice to see people and hang out, and it'll be good.
Mask or no mask?
It'll depend. There's some kids involved, so we'll see.
All right. Giana Magnoli, Managing Editor of Noozhawk, thank you so much for taking the time to talk to us about your coverage, and stay safe.
Yeah, thanks very much, Jerry. Nice to talk to you.
Bye.